Hey, good afternoon. Hopefully we still, what is it? We're not sleepy in this afternoon and have a spirit to join this congress. So I would like to present my presentation about brainspotting therapy for trauma survivor in Indonesia, insight into multicultural and multi-language challenges. So maybe I would like a little bit explain about brain spotting. Maybe some of you uh, still don't know, or maybe some of you already know about the brain spotting. This is actually David Grant, founder of Brain Spotting. He has found Brain Spotting in 2003, and he have the first book about brain spotting in 2013. He is from America. And brain spotting is one of the psychotherapy, and we can say that brain spotting is less verbal therapy. Brain spotting is a brain body based therapy, helps identify, process, and release trauma stored in the subcortex of the brain, as well as body memory. And brain spotting have two basic attitude that practitioner needs to have this attitude, which is neurobiological attunement and also relational attunement. Before we talk more about brain spotting, I would like to talk a little bit about the trauma. So many psychological issues are caused by the trauma, and also Gabor Mate, one of the one a professional concerned about trauma, and he mentioned that trauma is already endemic. And we can say that a lot of people in here, many people here have a trauma, and this trauma cause a lot of many psychological issues. And when we talk about trauma, we talk about the brain first, because our body, our trauma is stored in our brain. In which part of the brain that trauma stored? It's in the subcortical area, or in subcortical, it's contained of the limbic system and also the brainstem. And when trauma happen, limbic activity increase, and means that amygdala alarm increase, and it's make the reptilian automatically react to the amygdala alarm, and then the reptilian brain give give information to the body, and then the body react to it. And then what happened then? We have a sensation in our body when trauma happened, or when our client triggered by the trauma. So it's one of the example of the implicit memory. When someone triggered, is like heart rate increase, difficult to breathing. Maybe one of them have a hypersensitivity, muscle become tense or freeze, or any kind of defense mechanism, such as a flight, fight, and maybe angry suddenly, or maybe also feel stuck. And the interest also sometimes, our trauma issue is because sorry, our performance issue, it's because of the trauma. And then the other, what happened when someone have a trauma is the hippocampal activity is reduced. It means that the reducing activity in hippocampal makes someone who have trauma cannot uh, differentiate between right now and the past. So that's why we can say that that's some like a flashback. She felt that, oh, this is very triggered for me. Actually, the trigger is not in here, but in the past. So the trauma itself cannot differentiate between the past and the present, and she feel that the present is like the past. So we can say that it is like a flashback. Some our client also have this symptom. And then also neocortex collapse or error. Neocortex is area for we can say that human have this executive function, how we can logic to think logically, how we can talk verbally, how we can make decision, how we can concentrate and focus is what is it? It's uh, we use the neocortex area. But because of trauma, very triggering, when it's happened, the limbic activity increase means that neocortex energy in the activity in the neocortex getting lower, and that's why some of people who have a trauma cannot think logically, cannot when someone or therapist asks what happened to you, she cannot explain the detail, or even sometimes she cannot understand or thinking clearly about what happened. And some of them maybe also forgot about that. And then the interesting when it's the trauma very what is it, very severe or severe, even he or she cannot think clearly and not understand about what happened. And imagine when the trauma is happened in our childhood, when the neocortex still not improve yet, still not develop clearly. When therapist asks what happened to you in your childhood, and then he will say, I don't know. Why? Because first, her or his neocortex still not developed at that time when trauma happened, and then at that time, even her or his neocortex is collapsed. So, because of this, then for because of this reason, why one of the psychotherapy right now is focused on the areas in subcortical of the brain. So, and then we can say also that Bessel van der Kolk said that trauma is remembered through feeling and the body and or somatically. So it means that it's not easy when we when we want to intervention someone who have trauma, especially severe trauma, when we focus on the verbal or logically. So it's mean that we need to focus on the our subcortical area, and the brain spotting is one of the therapy focus on the subcortical. Another question is, how does brain spotting works? So David Brain mentioned about brain spotting is neuro experiential model. It means that in the brain spotting, we integrate neurobiological processes with the client's subjective experience. Means we try to uh, uh, help to healing the trauma in the context of a neurobiological in a trauma person. Means that we use a subcortical area through the eyes, because eyes have a pathway to the retina, and the retina go through to the subcortical area. And then also in neurobiological process, we also use the body sensation or tactile area, because the tactile area is represent of our subcortical. The tactile is what is it? The tactile sensation is what is it? The title the title who what is it? Who move the tactile, it's subcortical area. So it means that body sensation is represent of the subcortical area. And then we also not only use the eye, but also and body sensation, but also bilateral sound. Means that bilateral sounds that with ear also have a pathway to the midbrain in the subcortex. That's also help to the process the issue. And then the other thing it's about relational attunement. What the meaning of relational attunement? Relational attunement is more than empathic. Means that relational, every human have a basic needs like a food and water. What it is, it's about attachment. It's about our present. It's about our witness as a client. So when a trauma happen in some when someone have a trauma, usually they feel lonely, and then they feel that is it right, is it true, am I okay if I feel this, something like feel unsafe. So with the relational attunement that maintained by the therapist or the practitioner, it makes the client feel more safe. It makes the client feel ready to process her brain, to process the trauma. And then it's about the neurobiological process. And what the meaning of client subjective experience? Client subjective experience means our brains is contain more than 1 quadrillion synapse synapse, and it means that our brain is very complex. And then also our subcortical is very genius, because the process in the subcortical is very fast rather than the neocortex one. Means that because it's too fast, and then we can say also subcortical have to the subcortical itself has compet have competency to talk with himself. What the meaning? Because the subcortical can move and work very fast without our consciousness. For example, we not conscious when we breathing, or maybe in this room, maybe some cockroach come, and then suddenly, automatically, our heart rate become fast, and then we're very shocked about that. Means that our subcortical work by themselves, and also it means that the subcortical also have capacity to healing themselves. It's mean that the client have a subjective experience to process the trauma in her own body and the brain. So how we do that? We do it with eye position. Usually we do it by the pointer. We ask the client to look to some spot. So this is one of the example. This is David Grant in one of our class. This is the pointer like this, and then David will ask the client, what do you want to work on? And then after that, David asks the client to look to the pointer, and then David will ask the client to just follow the pointer, and he will look the reflex. And when the reflex is significant, it means that the subcortical area is activated. Means, and then David will stay in that spot, and then ask the client to just be mindful with that spot. And then David will relational attunement follow the client and keep mindful and ask the client also to mindful, observe himself and see what happened. It looks like simple, but actually it's not simple as that. Okay, and then also this is what the example when David used one eyes. So brain spotting is with the framework with eye position, body sensation, and relational attunement and less verbal. We don't ask too much when we process or when we help the client in the session. And then this is one of my session with a survivor of tsunami a couple years ago in Indonesia. And then this is also because brain spotting is very integrative therapy. So we can also not only use a pointer, but we can use very creative, for example, with children with the post-it like this or with the sock, something like this. So it's very what is it wide. If we want to do with something creativity, we could do it. Okay, so how about in Indonesia and the trauma cases? In Indonesia itself, we have more than 1,300 ethnic groups and more than 700 local languages. It is very challenging, especially if the therapists have a different language with the client. And then in Indonesia, our psychologists or mental health professional very limited. Sometimes it's challenging for us to talk with the client, especially with verbal, because we have a different language and culture. And then uh, even though in our country we don't have a statistic exactly how many people who have a trauma in here, but we can see that a lot of uh, psychological issue in here, very variation. For example, cause of the trauma, it's about traumatic violence, parenting style, multiple form of violence and crime in the community, natural disaster, challenging financial condition, and many more. And then again, when we do with the verbal therapy, it's quite challenging. But how about if we use the brain spotting therapy, which is brain spotting is less verbal? And actually, I'm curious about that. Then after that, my question is, what are the benefits and the challenges that brain spotting practitioner experience in dealing with trauma survivor with language and cultural challenges in Indonesia? So with this question, I interview 15 brain spotting practitioner, and these 15 brain spotting practitioner already minimum taken phase 1, and then 14 of them already take phase 2, and then one brain spotting practitioner still not yet take phase 2, but she already did an intensive. Means that the participant already taking more than one, more not only the basic but also the advanced. Means that the interviewee is the interviewees already have advanced skill of the brain spotting, and then they also have experience in handling trauma survivor with language and cultural challenges, because not some of them also have this experience, because for example some of therapists only handling trauma survivor who can speak bahasa, for example. So we choose the interviewee is who have experience in handling trauma survivors, and then some of them are already handle client from Java, Bali, also Lombok, Kalimantan, Sulawesi, Papua, Sumatra, Sorong, Sasak, Bima, and any other place. And then also in especially in Jakarta, actually not uh, not all of the children and teenager can speak bahasa. Right now, Gen Z, they prefer to speak English. So sometimes when we talk, we in bahasa we translate it to English. So and then what kind of case that handled by the participant related to trauma? They handle the case related to domestic violence, fatherless, abuse, neglect, controlling parent, attachment, bullying, insomnia, performance issue, relational issue, transgenerational trauma, natural disaster, suicidal ideation, depression, sexual abuse, and developmental trauma. And then from 15 participants, 8 of them also handle international clients, which is their expatriates and also immigrants from some countries in here, from Europe, America, and Asia also, and then refugee from Afghanistan, Somalia, Egypt, Ethiopia, and Eritrea. They mentioned that the challenging is quite the same when they handle the population in local of Indonesia with different language and culture. So how about the insight? What the benefit when they use the brain spotting? So 15 participants mentioned that because brain spotting is less verbal, we uh, try to help client to observe what happened inside them and then let the subcortical process it by themselves. It means that the focus is not about the language, but the focus is in area the subcortical. That's the primary focus. Means that sometimes when the process happen, some of our client talk, and then some of client also silent. So it doesn't matter whether the client wants to talk or not, but the important is the process, what happened in the subcortical. And then also, all of them also mentioned that they don't need to understand the detail of the background, the client's problem, including the client's language and culture. Some of the client didn't want to talk about the problem, and some of them also not uh, didn't aware or didn't notice about what happened background, what happened with him or the background of their problem. So it's not important anymore because the most important is about the process, how they feel after the therapy, how they feel with the issue, how they behavior, whether there is a difference before and after the therapy. And it means that the client doesn't need to open up and tell about his inner wound or problem when he doesn't want to. So and then because we give opportunity to the client to process it in subcortically, it means that a client have greater potential to gain their own insight. In brain spotting, practitioner mentioned that, well, we don't have to talk more and give more advice about what should they do, what should they do after this session, because the important is the subcorticals process it by themselves, and then she or he will gain their own insight. Means sometimes it means that the sometimes the therapist doesn't have to understand about what happened and then keep the client process it by themselves and keep them have her own insight. So The other things that they feel have a benefit with this technique is it can be applied to children, including with special needs. And even though less verbal, the result of the therapy can be can be can be seen from the body language before and after the therapy. And then Brainspotting applied in individual and group settings. And this is open and creative model. For example, in the conventional technique, we use a pointer. But after that, if we already know the framework, we sometimes don't have to do with the pointer. We can combine with other, and also we can also combine with other technique according the client needs and the practitioner competence. So the first basic is Brainspotting basic is about individual condition of the client, and then means if we know that it's very subjective, mean the approach for the client will be different. So because of that, David Grant create this Brainspotting as an open model, depends on the client's need. And then we could also do the Brainspotting with the picture, post-it notes, doors, various toys, card, natural object, and many more. And then one of the some of the participants mentioned that when the client feel unsafe or not secure to talk about the issue, we can also use resource model. What the meaning of resource model? Resource model relate to the condition that the clients want. We need to focus to the activation model. What is activation? Activation model is focused with the problem, but this is we focus to what you want, what the condition, what they want. I want to more calming. I want to be more positive. I want to be relaxed, something like that. And we not only, if you look the previous slide, when David used pointer in one spot, and in Brainspotting, the advanced one, we can also use more than one spot. So it means that the participant mentioned that we can very creative in apply Brainspotting, but keep in the same frame. What the same frame means? Keep with dual attunement frame. Neurobiological attunement, we use eyes and body sensation and also relational attunement. But inside there, we can do it with creativity and open model. And because we focus, because the Brainspotting focus to the subcortical means the process the trauma can be processed deeply. Not only have processed the trauma, but it also could improve performance. And then they also mentioned about a deep connection occur. The practitioner with the trust, presence, and mindfulness, non-judgment, empathy, and compassionate with the client. And then it means that the client feel accepted and safe and broke the defense mechanism, and it also minimizes misunderstanding during the therapy process. When the client feels something in the process and he talk a lot with her mother language, for example, we don't have to understand verbally exactly what he said, but what therapists do is just attune, present, and then just understanding what happened without have to logically verbally understand about what they said, but just witnessing, mindful with the client, company the client. It's have a very beneficial for the clients. And the interesting, some of the practitioner also mentioned that this help them to have personal growth, because when we do it, they said that it's make me become very empathic or patient, and then also it's impact to their personal life. And then what about the challenges? Of course, there is some challenges happen when we use this technique. Some of practitioners mentioned that is it not easy to give initial education about brain spotting and how it works, for especially in the first session. How or they feel that is it right to only look to the one spot, it could help me, something like that, skepticism from the client. This is also the challenging. So and then also for the practitioner who were previously more accustomed to verbal protocol-based therapy, often need to adapt to apply the brain spotting technique, because in this technique, there is no protocol or plan to do the process of the therapy. Because when the first client come, and the second and the third session, first, we need to ask, what do you want to work on for today? So it's not about, okay, this is our second session, we will do this. No, but it's about maybe it will be a different issue in the second, in the third, or the fourth session. And then what I mentioned before, that some clients are skeptical or feel confused, especially at the beginning. What is this? Just only look at that. What happened? There's nothing, something like that. Especially when we have dissociate client who cannot connect with their feeling, and then how do you feel right now, and they will say nothing. So it's also challenging. So it is needs creativity, especially when working with children, when some of practitioners feel not creative, so it's quite challenging for them to use the brain spotting. The in-depth client process sometimes make practitioner with unresolved issue more susceptible to trigger. We call it as a limbic contrast transference. And then practitioner need to be deeply present and attuned to the client, because the core of this therapy also the present and the mindfulness witnessing of the therapist. And there is no plan or protocol, so practitioners sometimes feel it's what is it? So they need to prepare for anything. So because it's not protocol and see what happened, sometimes some of the practitioner feel unsafe with this situation. And what is the conclusion? There are various benefits and challenges experienced when brain spotting practitioners have help clients with trauma who speak different language and come from other countries. However, the benefits are significant enough to make brain spotting as an alternative modality that can be used to support trauma processing in both individual and group setting. And for future suggestion, this research was conducted solely on the basis of the perspective and interview of the brain spotting practitioner. So for the next, maybe this research could be expanded by examining and interview the client, so we can know how this brain spotting whether it works or not from a client's perspective. And then some participants from 15, there is 8 participants who works with international clients, means that maybe we can also not make a research in Indonesia, but also with clients from other countries who face language and culture challenges. So means that we can do a broader study, not limited to Indonesia, but in other country or international who have also have language and cultural challenges. That's from me. Thank you very much. Thank you for listening.
So thank you for that study. And yes, we have seen that mental health conditions, especially like in the trauma spectrum, that these mental health conditions are highly biological, and a practice like in brain spotting can actually be something that could help individuals who undergone trauma, and this would actually transcend language barriers. So with that, we have questions for the presenter.
Thank you. Nice presentation. I interest in brain spot therapy. Brain spot therapy. And I have two, three questions. The first one is the trauma is center of the brain inside. You show the figure. Are there any material or something of trauma appear in the position?
Can you
No,
mention again?
it's just the image, or are there any materials inside?
I hope this has answered the question. May I a confirmation for your question? Means that whether I have a material about what happened inside about the brain who have about trauma in the brain. It means like that.
In the case of dementia, alpha-synuclein is appear first inside, then spread in the brain. So it is shown by after the client died, we can recognize how about the trauma?
Yeah, as I know, because I didn't do research in brain, what is it? Brain mapping maybe, or so as I know, there is a German a doctor, a neuropsychologist, and then his name is Damir Del Monte, and then he took a lot of research about brain, including brain spotting, and then he do a lot of research about what happened in the brain, including and even though when we have an image in with EEG or any kind of tools to look the trauma, as I know, the subcortical is activated, so means that the color, and that we can see the activated inside in the subcortical.
Using EEG, we can get map of the brain.
Yes.
We cannot, because EEG is detect the whole of the brain activity. So the partial decline cannot detected. So I'll continue to the next question. You said in
bilateral sound.
Biolateral sounds.
Bilateral sound. Yes.
Through ear.
The ear. Yeah.
Do you know the frequency of the sound?
About the frequency, I don't know yet about that. But the theory why David Grant create the bilateral, it's actually from EMDR. Do you know EMDR technique? Because before he found the brain spotting, he is a EMDR practitioner and write a book about EMDR. And then when we use before bilateral EMDR, we use bilateral sound. This bilateral sound is to what is it? To regulate the midbrain area by using what is it? Using stability with music. And when you use the bilateral, you can hear that the music is different from change from this one to this one, and this one, but constant. In bilateral, David tried to do it with randomly. Means that sometimes the client use in here, maybe can hear in here longer and maybe very clearly, and then this is not clear, and then it's very random to reduce the what is it to make the process keep going, because sometimes when it's constant, it's already have learning process in there. But in the context of frequency, as we know that a lot of process, as we know that a lot of music also about the abundance or healing, there is a sum of frequency. So actually, I still cannot answer about that. Okay. But what happened with the music from here and here, David mentioned it's also regulate our superior colliculi in the midbrain, which is superior colliculi is have function to regulate our body, including the emotion.
Okay, thank you.
You're
I'd
welcome.
like to talk more about it later.
Okay,
Thank you.
welcome. Thank you.